The chair recognizes himself for an opening statement. Today, the Healthcare Subcommittee is taking an important step in reauthorizing critical programs within the Health Resources and Services Administration. The policies before us today each play a unique role in providing greater access to care for millions of Americans, particularly those in rural and underserved communities. Many of these programs expire on September 30th. By taking early action, we are providing reassurance that they can continue without disruption. Early action also provides subcommittee members with the chance to review the impact of the policies are currently having and ensure all future funds are directed in the most effective and appropriate way possible. It also gives us time to work together and find bipartisan offsets for mandatory spending in future years. The first bill, the Strengthening Community Care Act of 2023, would extend the Community Health Care Fund and the National Health Service Corps through 2028. Both programs allow millions of Americans across the country in medically underserved communities to receive access to high-quality primary care services, including pharmacy, mental health, substance use disorder, and dental care services. Across Kentucky, HRSA's Uniform Data System data shows that 25 health systems received grant funding in 2021. Nearly 600,000 patients were served, many of which were served by providers who participated in the National Health Service Corps. I want to thank Dr. Joyce for leading on this important issue, especially at a time in which we are facing primary care provider shortages across the nation. I am hopeful we can come to a bipartisan agreement on a path forward to extend funding and on the necessary offsets for the Teaching Healthcare Center graduate medical education program. I am committed to working with my colleagues to continue these essential programs. However, I do think we should not make these programs permanent at this time. We're examining the National Nursing Workforce Center Act led by Representatives Kim and Blunt-Rochester. This bill is designed to help bolster our nursing workforce and would specifically require HRSA to work with state nursing workforce centers to help streamline their nursing workforce programs. This would ultimately provide more targeted investments that reflect the need of local communities. I thank my colleagues for working on this bipartisan bill. I also would like to thank Representative Blunt-Rochester for working with me on one of my nursing workforce priorities, the Building America's Healthcare Workforce Act. This would address very serious nursing workforce shortages in the long-term care community. I will continue my push to advance legislation like this that cuts red tape, especially as we near the expiration of the COVID-19 public health emergency on May the 11th. We will also consider proposals to provide continued access to key programs for chronic conditions such as diabetes. The Special Diabetes Program Reauthorization Act of 2023 and the Special Diabetes Program for Indians Reauthorization Act will provide continued funding for both programs through 2028. Over 1.6 million Americans living with type 1 diabetes, these programs will allow patients to continue receiving comprehensive diabetes care and will lead to a higher quality of life and lower healthcare costs for patients. I thank Representatives Bilirakis and Cole for leading on these issues. We're also considering legislation that will promote more transparency and greater access to care for over 100,000 individuals in need of an organ transplant. Dr. Bouchon's Securing the U.S. Organ Procurement and Transplantation Network Act would ensure the nation's organ procurement system is operating more efficiently, which will ultimately lead to greater access to organ transplants for vulnerable populations. Lastly, we're examining a proposal to increase transparency within the Covered Countermeasures Injury Compensation Program to help ensure claimants are receiving adequate information in a timely manner. I look forward to today's discussion. I thank the witness for being here, for being with us today, and I yield back. The chair now recognizes